Keys. All right, so I think we're going live. Is that correct? We're on? All right, we're on. Well, again, I want to thank everybody that's on here today on this panel, of course, first, and then everyone who's watching. I appreciate it very, very much. And yeah, as I was saying right now offline, it's a difficult time at the moment. There's a lot of uncertainty in the air, obviously. The pandemic, number one, but we also have an election. Obviously, there's a lot of tumult in the country, a lot of things going on. And thank God, during this difficult time, we have people that serve, people that stand up, people that know how to put country first. That's our veterans. And unfortunately, some of them are coming out now at a very difficult time. And so they need help, and we should be there for them. We have some great people here today, some great panelists that have served. We also have an American hero in Thomas Anderson. There was a Vietnam veteran that's here today. And we appreciate his service and all that he does down in Imperial County for veterans and everywhere. So again, I want to thank everyone that's here. I'm going to have the panelists introduce themselves in a second here. And again, I want to thank you. We look forward to your questions. And again, I can't tell you how proud we are of all of those of you who wear the uniform, who have worn the uniform, who have served our country through difficult times, through good times. As they say, you sign that blank check. And when you sign that, it's something that the rest of us benefit from tremendously. We have our freedoms because of the sacrifices that you make. And so we appreciate that. So here today, we have a number of participants. Why don't we start off here, let's see, with Stacy. Stacy, why don't you go ahead and introduce yourself so people know who you are?
Thank you so much, and thank you for the privilege of being able to be here and be on this panel. My name is Stacy Odell. I'm the programs director for 0800. We are a military transition support program, so we work with those service members as they're getting ready to make that transition from active duty to the civilian life. We just provide resources and help them navigate the abundance of resources that are available to them in the Southern California area.
Thank you, Stacy. Appreciate it. We're going to get to you in a second again. Okay, why don't we go to Patrick? Why don't you introduce yourself? And the great job you've been doing, by the way. We really do appreciate it. Since you've been here, you've been doing a great job. Thank you.
Thank you, Congressman Vargas. Again, my name is Pat Priebe. Thank you for allowing me to be here today. I'm as part of this panel. Thank you, everybody that's viewing, for their service. Again, I'm the director of the San Diego VA Benefits Office. And our primary mission is processing disability compensation rating claims. Those are done nationally, but we do try to do the majority of those but based on zip code where the veteran resides. And we also offer outreach services throughout Orange County, Riverside, San Diego County, and Imperial County as well.
Thank you very much, Patrick. Appreciate it. And then we'll go to our real American hero here, Thomas Henderson. Now, Thomas, I have to tell you one thing before you get started. Recently, sadly, Memo Cavada passed away. I don't know if you ever met Memo, but Memo also was a Vietnam veteran who was injured, saved one of the members in his Air Force unit's life. And then he came home and became a photographer. And he was a photographer here in San Diego, and I don't know that there was anyone more beloved than him. And sadly, he succumbed to cancer recently. I went to his funeral, and the things that were said about him, both during his service in the Air Force during Vietnam, his lengthy service, and then when he came home too, just an all-around American hero. You again, our best people are really our best American citizens, our best people on this planet go and become serve and then become veterans, and you're one of those. So we welcome you.
Thank you. My name's Tom Henderson. I have difficulty with the hero part, but I am a veteran. I served first as an enlisted man and later as an officer. I'm currently involved with VFW Post 9305 here in Imperial County, and I'm the executive director of the Imperial County Medical Society. So I'm really happy you gave me an opportunity to participate in this discussion because we have some real needs down here, and it's really vital that we get a chance to share those with you. Appreciate it. Thank you.
Thank you, Tom. Appreciate it. So why don't we go ahead and get started then? And I'll ask this question. Since you brought it up, Tom, I mean, right now, it is a difficult time. I mean, it's a unique time, I think. I certainly don't remember a time where we've ever had a pandemic like this. You know, we've had other issues, other medical issues come up, but nothing like this. This really is unique, I think, in American history. And so during this time, what are the most sought after resources, Tom, and also for the rest of them, but Tom, why don't we start with you? What are the most sought after resources that people look for right now, veterans, during this time of this pandemic?
Well, I think most important is the fact that we have so many veterans that have such a wide variety. We stretch everything from those that need to get to the VA in San Diego, who lack that ability to get there on their own. The services that we had providing transportation prior to this are no longer functional. And so we have a lot of vets that really need to get to San Diego and can't get to San Diego. And so if you ask me, number one, I would say we really need to take a look at a way we could transport our veterans back and forth to San Diego. And I know that's not the main discussion topic, but it's an issue because the folks just don't have the capacity. And then I would say that we need to greatly improve our ability to have mental health services for our veterans here in the Valley, especially PTSD. This pandemic has impacted a whole lot of people. I'm in contact with a lot of my fellow Vietnam veterans, but where I'm also in contact with other veterans from the global war on terrorism. And this whole pandemic and the whole lockdown and all the things that go with that are really exacerbating those issues. And so we really need to consider how we can work around that, perhaps providing VA services more directly down here in the Valley, a dedicated group, a dedicated area that would allow gatherings once they are authorized, online group, mental health services. There's a whole lot of need for services that I become aware of myself through my fellow veterans. We'd sure like some time down the road, and this is kind of early, but thoughts about how we can help place homeless vets. We know that veterans make up a good portion of our homeless population, and we lack the resources that you find in major urban areas. We're like the rest of rural America, so I don't suspect we're a whole lot worse than the rest of the country. But it's a major issue, and if we were able to find some way of housing, at least on a temporary basis, and by that I don't mean by one night or 2 nights, but a period in which people get their head squared away so that they could get in their claims that probably exist, but they can't process. They don't have a place to be. They don't have where the mail will go. And you know the litany of all that stuff. So those are 3 things that come straight to the top of my mind.
Could you just clarify one thing for us, Tom, if you don't mind? When you say transportation, now a lot of things have changed from transportation, of course, because of COVID-19. One I know for a fact is that a lot of the volunteers that we had previously that are up in age can't do that anymore because of the possibility that they would contract COVID-19,
right,
and get sick themselves. Is that one of the issues? And what else? Could you just obviate that for us?
Well, I'm just thinking that we have multiple veterans. This is off the top of my head, and I don't have any monetary research. This is from my discussions I've had with others. Is if we used to have the DAV van, and that's not traveling, and it was a small van. People were tightly packaged. If perhaps one of the transit agencies here in the Valley or one of other transportation groups that had a larger vehicle that could make a once-day, up and back trip to San Diego to the hospital there, it would be greatly appreciated. I mean, we get a lot of service here from our local clinic, but there's a lot that they can't get. Their vehicles, a lot of our veterans' vehicles, especially some of our older Vietnam veterans that are not in good financial position, simply can't go. and the DAV is not functioning like it was. And so what good does it do you to have an appointment with X when you can't go there? And by the way, that's not limited to veterans. As the medical society, I'm often dealing with local healthcare plans because citizens that belong to healthcare plans get referred to specialists with the same problem. They can't get there. So it's not just vets, but in this case, it's a particular issue for veterans.
What about the other panelists? If you could comment on the issues that were brought up and others, if you don't mind.
For us, transitioning is that really that hasn't changed. All of our transitioning service members are looking for employment. That's their number one need, their number one resource. One of the things that I will say is beneficial is the military did allow them to extend. So a lot of the service members who enrolled in our program who were slotted to get out over this last year did elect for that 6 months or that year extension to be able to prolong their transition. But for us and the population that we serve, those transitioning specifically service members, employment is always the top resource. During COVID, it's been a little bit different, I should say, to do interviews and to do the resume prepping. And so as far as resources and accessing those resources are concerned, for 0800, that's what we've seen is employment is definitely still top of mind. And education would be the second. A lot of our service members do want to further their education once they get out of the military, and that transition from online to ground or ground to online has been problematic for some, but I will say that we've gotten good feedback about how they've allowed those service members who were receiving that BAH, because a lot of them, that's what they use for their income so that they can focus on school. I know that just our personal experience when my husband was doing it, that BAH was pivotal to him being able to focus on school and have maintain some kind of income. So having the ability to do those online classes and still get that has been good for them, but it's just navigating everything, getting in touch with people. Who can they talk to? It's with COVID, a lot of organizations had to scale back their staffing. And so who the people were available to contact, the contact people that we could reach to was an issue. But I still see that. I think we've downsized. Remote working does tend to put a barrier there for our service members getting in contact with people. But it's mostly just access to those resources, is knowing what they are and how to get in contact with them.
Now, Stacy, I know one of the things that has happened nationally and locally here, of course, both in San Diego and Imperial County, is a lot of people have lost their jobs. I mean, there's a lot of people that are unemployed or underemployed because of COVID-19. Have you found it harder to place people in jobs, to help people transition into jobs? I assume that has been a difficulty. I know I've heard from a number of people, veterans, saying that it's harder for them this moment than they thought it was going to be because of COVID. Have you found that to be the case?
I think accessing the resources that we had previously is what's made it more difficult. There isn't someone you can sit down with and go over your resume to make sure your resume is good. Doing these Zoom interviews or the online format has just made it a little more problematic. A lot of our service members were either going to school. I can say that our enrollment has definitely gone down as far as the people we're working with, just because they opted, like I said, to stay in a little bit longer, so we aren't engaging with them as much. But we're getting close to that time period of where it is time for them to transition out. And so making those connections is what has been difficult, trying to get those networking possibilities. Networking is so difficult for them to do, and we know that that's extremely important for our service members when they're getting ready to get out, finding those connections and being able to work with those people. So I would say that those are the major barriers. The difficulty in finding the jobs, and I think that the jobs are out there because I have seen people getting jobs. It's just knowing where to look and how to find them that's become more difficult.
Thank you. And yourself, Pat, talking about the issues that you see right now.
Well, I think the biggest issues that we're facing is our face-to-face interaction due to the COVID pandemic. And what I did is I just posted a link here in the chat where veterans can go to us on a web link. You can get to it through www.va.gov, but I also did a direct link to our San Diego VA regional office where you can do what's an appointment via WaitWhile, and we will have one of our benefit counselors reach out to you if you need assistance. You also have we also have phone numbers posted, and we have if you go to that site on how to get a hold of us. So in terms of VA benefits, the mail, you can still mail in claims and evidence to the scanning vendors, which are on the back of those VA application forms. Those are still ongoing. The 1-800-827-1000 number is still available. And all of our claims processors, we've been able to continue processing regardless of where we're located. Many of those folks are teleworking at home, but we're able to do pretty much all of our business electronically. Again, what's hampered us during the pandemic is the face-to-face interaction, or the person that needs a more human interaction. And again, through this link, you can get a hold of us if someone is challenged or having trouble submitting or starting a claim, or just lost in the process to apply for VA benefits. We'll have one of our counselors reach out to you and get a hold of you.
One of the things I was going to ask, and my next question was going to be, adaptation. So when you're talking about, they're missing the face-to-face. I know a lot of us in politics too. We've been away from, one of the odd things, we've been away from Washington quite a bit. And when we go back, we actually don't have a lot of face-to-face. We used to talk. We'd go and talk, and you try to figure out what the other side wants to do and is willing to do. And usually in that face-to-face, you figure out some compromise that we've had to attempt to adapt, but it's hard to do it virtually. It really is. And it sounds to me that you have the resources there, but people don't have this face-to-face. You're attempting to adapt, but in a practical way, how has that worked out? I mean, have you been able to adapt that much?
Yes, we've been able to adapt pretty well. I'll tell you, we did run into a hiccup in terms of, as part of disability compensation claims. The old way of doing it was usually an in-person C&P disability examination that was either done by a VHA provider or a contractor. Well, unfortunately, during COVID, as everybody was adjusting to the protection and the social distancing, those type of exams were suspended from about April 8th through about June 8th. Now, those examinations have resumed in 95% of the country, but during that suspension of those C&P exams, we have noticed that it's had an impact on the processing of our claims. We were finishing them in about 90 days. And today we're finishing it in 108 days. So it has impacted us. But again, those exam contractors now are up and operational at 95% of the locations and we find that most of the veterans are going to these C&P exams now. And so we're going to see an uptick in those completed examinations, and our timeliness will get better, back down to about the 90 to 85 day range. So that's what has had an impact on our work. It was those face-to-face C&P exams as they adjusted to doing more things virtually. For example, I had a VA appointment that was all done virtually compared to when I used to go in and see the doctor. So it was that adjustment period from April to June that we're seeing the effects of now. But I think folks have adjusted more virtual, more things on video, if it can be done on video and answered on video, and it doesn't need in-person exam. I think It's been sorted out. And again, I just want to emphasize that those exams have picked up again in 95% of the country. But that's where COVID impacted us the most.
But Casey or Tom, I mean, how have you seen the ability to either adapt or adjust, or the inability to do that during this time?
Were you addressing me, sir?
Yes, Tom. Either you or Stacey. You go ahead, Tom. You go first.
Well, for veterans my age, Vietnam veterans, many of them are not as technically proficient as the younger folks. And so they ended up behind the 8 ball on a number of these different areas. And quite frankly, because I run the medical society, a lot of physicians were initially either reluctant or slow in implementing the telehealth. So the combination down here around technology has obviously had an impact. And I would suspect also in terms of 0800, when you're talking about the market, you're not talking about our market hiring down here, are you? Because we have so much still shut down. We're still widespread. We have never moved out of the widespread rating at all down here. And so are they actually able to find jobs down in this area? So I just tossed that out.
Is there an answer to that? I mean, I thought that people are still having a very difficult time.
Yes.
Just to be fair, I mean, we've been pushing the HEROES Act in Congress, a lot of us on the congressional side, because, I go to my district and I see a lot of stores that are closed. I see a lot of businesses that have lost, that are no longer exist, that they've closed up. And I know people worked there before, and it's been very difficult. That's why we've been attempting to put, another package together, and hopefully we will get one here soon. I don't know, Stacey, could you talk about maybe what you've seen down in the Imperial County?
Well, we're in San Diego County,
Right.
And we do service Imperial County, yes. But we haven't had very many of our service members from Imperial County enroll recently. That's one of the things that we've seen. Enrollment has dropped dramatically in our program since COVID. I would say that was probably one of the biggest ones. Some of our service members were already in the process of working towards it. So with programs like your Skills Bridge, that was the word I was trying to get. Sorry about that. Skills Bridge, they're getting to go this. And again, like I said, too, a lot of them opted to stay in, and they've been working on it that way. I know that a lot of organizations are usually reaching out to us because they have job listings and job boards, and I know that there are some jobs out there. It's definitely decreased, but I do know that that's one of the things that we work on, is trying to find those organizations that do have open positions. And I know that in San Diego County, some of our service members have still been able to find employment. It is more difficult, but there is stuff out there. It's just harder to access it. And yes, agreed, it has definitely slowed down. There are jobs that are not available, but it is finding those placements that have positions open, and depending on what the service members want to do. A lot of our service members also do opt to go back to school, and that really is a lot of what they're doing as well. And some of those school programs have those placement options for them at the end of it. So we try to find them, help them with picking a school that will have a job placement opportunity at the end of it as well. So that's more or less what I was referring to. But again, you are correct. Employment is an issue all the way around, and those job opportunities are there. I know the Imperial Valley is a little more difficult to find employment, and even resources. It really is difficult. It's one of those hard points, because a lot of them do end up having to come to San Diego County to get the resources they need, especially the veterans, because this is where a lot of our VSOs are. There's so many veteran resources here in San Diego County, and we really are blessed to have as many as we do. So that I hope that answers the question.
It does. But one of the concerns that I have, and I think you hit it well, is I know that many of us in Congress and in the Senate were working with and asking the military to extend for people that were going to come out now, because the truth of the matter is we thought it's going to be very difficult to find jobs and to transition during this pandemic. Now, to be fair, too, we thought the pandemic was going to be shorter than it is. It is grown in length much more than we originally expected. But my concern is that a lot of people now, as they transition out, now that their extension's over, are going to come out during a time when there's not a lot of opportunities. I don't know if that's going to be the case, but that's been my concern, that the timing is going to be difficult. We were all hoping that this pandemic would be short-lived, but it turns out it's not short-lived. It's been much stronger, much more powerful than we all originally expected. And again, I know that even talking to some people that the Navy maybe hasn't done all that it could, maybe working with some of your organizations. Maybe they have their own issues at the moment too. But the truth of the matter is, it seems like a lot of people have extended, and as they're coming out, the job market seems very difficult. I mean, am I wrong about that?
No.
No, I don't think so. I think you're correct.
Even in the best of times, Imperial County has a very difficult time economically, even in the best of times. And this is certainly not the best of time. But you didn't make a point about the VSO officers, Stacy, that I really like to emphasize. They really have a hard load to carry. They're carrying it really hard down here. I would like to mention specifically two. First of all, Federico Garcia, who runs our local VSO office, who took over about 2 years ago, más o menos. He's doing a really good job. And there's a lady whose name I want you to burn in your brain, Congressman Vargas. Her name's Lorena Lacar. I suspect you may have heard of her before. Yeah. But if you haven't, she's literally like the mama bear for, all the veterans down here. And we're working to upgrade her position to a senior service representative. But she literally, we are her family. She's a mama bear. It's crazy. And she does a wonderful job for our veterans down here. And, you might one day want to zip a letter out and say, you know what, Lorena, you're a pretty good old gal. So that's my toss for the VSO.
You might be on the line, but you're right. I know she is, of course, and everyone says the same thing about it.
I didn't know she was on the line. My apologies.
I'm not sure. She probably is.
Yeah.
I totally agree with you. Totally agree. But again, my concern is that this pandemic is creating a difficult time for everybody. I've said it and I'll say it again. I think the federal government is the only entity large enough at the moment, really, to provide a backstop to all of this. And we have to do more. And I hope that we do with some compromise package that we do with the Senate and the Democrats and the Republicans, because otherwise I think it's the transition that a lot of the people that are leaving the military right now are going to have. It's going to be extremely difficult, something that they don't deserve after the service they've given us as a nation. So I'm hopeful. And I'm hopeful if we can't help everybody, at least we can help the veterans. At least we can help the veterans. But again, I'm hopeful of this. What, Pat, do you want to join us in this conversation? You see quite a bit from the global level of veterans. What do you have to say on this issue?
In terms of returning employment, I think what we're challenging is folks are eligible for what we call Chapter 31 benefits. So the classic example is me, a guy who served in the artillery, and then when I was done, I had no civilian skills to that, in terms of taking my artillery skills to the civilian market. So there's our Chapter 31 program. So what we're focusing on is getting those folks enrolled in Chapter 31 and finding suitable, we've entered 1,500 new veterans this year, written plans for them to find some type of new career in the job market. And obviously that job market is changing now, but where it's sustainable employment for long-term employment. And so obviously not steering folks perhaps towards the leisure, hospitality, maybe the food and beverage has suffered. So, more, I guess, technical and distant type positions that are more flexible, that you can work in various settings and don't require a lot of face-to-face contact, so to speak, or if they want to be an EMT, an emergency technician, or whatever, but we're trying to steer them to where they'll be good job prospects when they're finished with their program, 6 months, a year to, some of these could be 4-year programs. So we're trying to steer them on what we all are trying to grasp with what we think the new economy will be like.
Yeah, now I was not in the military, but I was in the Jesuits. I was in religious life for a little over 4 years. So I decided I wanted to get married someday, so I left. So I had a little bit of the artillery problem myself. No one wanted a theologian or a philosopher, so I had to get into a practical skill. I became a lawyer. You're right. I had to be retrained because no one wanted a philosopher.
If I may, I'd like to inject something here, because an area of employment that really exists here in Imperial County and throughout the nation now, there is a huge need for folks in the entire spectrum of the medical and dental health care broadband. Everything. The state of California and the feds have money available to help people either in scholarships or what we call the health professional shortage areas. If they come here, if they're willing to come here and live and then work here, they can get their student loans paid off. This is for doctors. This is for nurses. This is for x-ray technicians. That's where rural areas actually have a little edge on other areas, in that we can offer them the opportunity to work off their student loans and gain experience. And as I do want to add one other thing. I went in the Army. I was an enlisted man. I was a radar repairman. I became an officer. I later commanded a missile site. I translated that into computers. I was an educational technology leader for many years here in Imperial County. The military, the things you learn, you just have to be imaginative as how they reapply in civilian life. And so I'm so glad to see 0800 and other folks writing plans to get folks to understand that, there isn't much need for a machine gunner. But a machine gunner learns a whole lot more than being a machine gunner. He learns about cooperation. He learns about teamwork. He learns about leadership. And so you're right. Our veterans are a mainstay for our nation. And so thank you for keeping them in the forefront.
Thank you. Another thing that I would add, Dom, obviously you made a great argument for the health field, the medical and dental. I would also say alternative energies. Good or bad, we are going to definitely invest a lot of money in alternative energies. As you know, in the Valley, we've invested quite a bit, and there's lots of opportunities. That's also a good field for people to get into, I think.
Absolutely.
We'll give them a long-term employment that's going to be beneficial for them and their families. Yeah. And again, the things that they learn in the military oftentimes are very applicable when it comes to that. People forget how sophisticated the service is when you come to energy. Whether it's you're serving on a nuclear, submarine or a nuclear aircraft, or whether you're, in the Air Force and you're looking at those planes. You learn a lot about energy in general. And again, that's a field that I think is going to do well.
Absolutely.
I think we should probably, and sadly, talk about this, because this is an issue that we're confronting all the time, the issue of mental health. Mental health is an issue in our society. People have been stressed dramatically during this pandemic for a whole host of reasons, not the least of which, of course, was the overlay of politics, but also the pandemic itself, not being able to see family, friends, staying away from people, the loneliness that befalls a lot of people. And it seems to, in particular, harm our veterans dramatically. Let's talk a little bit about that if we could.
Absolutely. If I may, and again, if PTSD, isolation is aggravated, has been aggravated by this pandemic. Within our own post, I'm personally aware of a number of our members that have had significant issues related to the isolation. As active as I've been, on occasion, it's kind of made me a little nuts, and I'm in contact with more people than most. Not physically. I think I spend a great deal of my time reminding folks that this isn't a joke and it's not the flu, and you can kill yourself or others. And so it's hard, and the pressure that puts on people to that want to see. I've got a great grandson, and the desire to see them for Thanksgiving. And where do we weigh that against potential cost? And there's other guys that don't have extended families. The veterans are the extended families for many vets. Many people in our posts are single, and we were their family, and we met every Friday morning for breakfast. Now we have a Zoom call, but it's nowhere near the same. People are getting depressed. You betcha. PTSD is an issue. We need a mental health group down here. I don't know, under current regulations, you could even do it, because you can't have more than 3 separate households together at any one time, unless you would go outside. And I think, but there is a need for more mental health service down here, co-located here. So it's not a matter of doing a Zoom call, but it's a matter of even if it's just 4 people in a room separated by 12 feet or 9 feet or whatever how many feet you need, that they have a feeling of human interaction, because so many of these guys are alone, especially my age group.
I'd like to discuss that a little bit too. Our staff, that's one of the reasons why our staff at 0800 is also clinical social workers. While we're not providing any mental health services, we are there to hear what they're not necessarily saying. I think one of the biggest issues that faces our mental health is, I'm just going to throw it out there, stigma in the military, stigma of, if you have a mental health issue, are you fit for duty? And we know that that's, as you know, in that mental health field, that we can get the help if we want it, but there is still that stigma out there regarding mental health. And that's, I think, our biggest barrier to our service members wanting to go get the help, or wanting to say that they feel depressed, or wanting to say that they're anxious, or they had a panic attack, or getting those diagnoses of their mental health needs. And so when we're talking about mental health, I think we have to very first start with the stigma that's out there about it. It's okay to not be okay. That's one of my favorite sayings that I've kind of grasped onto, especially this year. It's okay to not be okay, and to find and access those resources with confidentiality and not have to worry about it. My personal experience, my dad did 32 years in the Navy. My husband did 23 years. He was active duty Navy and then retired out of the National Guard. So I know that one of the things that they always said was, I'm a tough sailor, or like, I can handle it, or that's my job. And hearing them say those things and knowing that they've also had mental health struggles. It might not have been severe to PTSD, but they still couldn't voice that they had those problems without a fear of a comment, one of those sick bay commando jokes or something like that come along with the stigma that comes with mental health. So I think that's a very important piece that we just have to give a voice to, that there is still that stigma, and we need to find a way to make it okay to say, I don't feel good right now.
Yeah.
If I can add, I know this isn't perhaps the ideal answer for the older generations, but I guess better that late than never. VA started doing the VA transition assistant briefs around 1995. So now members are more attuned when they separate from service of their eligibility for VA benefits. So, and then last year, VA started the Solid Start program. So if you're leaving service, we have VA representatives that call the veteran when they're 90 days after discharge, 180 days after discharge, and then 1 year after discharge to check in on how they're doing, if they need assistance with either medical care, VA benefits, or mental health. If they're not trained to take that call, they refer them to, a appropriate social worker or healthcare provider. So VA, we're starting to do that by reaching out more. And again, that started last year. And I just encourage everybody. I think I don't have the statistics in front of me. This is more of on the healthcare side, but suicide is higher in the community compared to if a veteran was receiving enrolled in the VA medical healthcare system. So again, if I encourage everybody to get enrolled as well in the VA healthcare system. But I just wanted to do that plug for the Solid Start program that started last year. So as we learn these things, we continue to get better for those that are serving now based on our experiences of the past.
Well, Pat, since you brought this up, then, the Solid Start program, resources. I mean, resources are always the issue. I mean, we right now we're attempting to get more resources through a package deal that we're trying to compromise. I mean, what about that? What can you tell us? Because everyone lacks resources to some extent, and right now, when the need's so great, it seems like we don't have adequate resources to do what we want to do when it comes to helping veterans, especially with mental health issues.
Right, and I would say the agency made the commitment to have enough call agents or the capacity to reach out to those veterans that are discharged. I think it started last January, so at least there's enough resources to make contact with or attempt to make contact with every separating member that has gotten out. But the resources that I struggle with is, my folks need to process disability benefits. They need to make decisions by looking at the evidence in front of them. And so, obviously there's never enough resources for me to go out throughout San Diego County, Riverside, Imperial, or Orange County to meet with all the different groups that want to see us. So hopefully as the population gets more and more savvy with technology, my kids and grandkids are much better than I am, but folks will be able to reach us easier as they become more attuned to technology. So in terms of resources, I just need decision makers, and unfortunately I don't have enough ambassadors that can go out and give briefs and so forth to the community. So that's where we try to focus, where we have the biggest bang for our buck, where there's going to be a lot of people either in attendance or on media, or we've invested a lot in the local bases where members are transitioning out. So we have folks at 32nd Street, Balboa Naval Medical Center, and Camp Pendleton and Miramar. So at least we're touching them when they get out now.
Well, Pat, I have to say, everyone that I've talked to, and certainly I'm part of this, thinks that you've done a magnificent job since you've been here, and you do all the outreach that you possibly can. But I have to say, still, as we see suicides and we see mental health and we see a lot of our veterans on the street, I mean, the government needs to do more. I mean, sometimes I get very frustrated about it, because I know, when you see someone who has served and then you see them on the street, or you see them later on, in a situation where they're being buried by their family, we have to figure out how to do more.
Right. And one of our emphasis is on the homeless, especially in San Diego County. And obviously sickens all of us if there's ever a homeless veteran. But again, so we try to partner with the San Diego Police, Veterans Village of San Diego, the convention center, and wherever it's needed. Just, we're at least making a dent. So like in San Diego County, the veteran homeless rate went down 12%. It's not zero, but at least we're starting to make some of a dent. And I know that will probably continue to be a priority regardless of the administration.
Sir?
I agree. Yes.
As I'm listening to this and I'm recognizing, when I hear resources, I always think in terms, because even when I was in education before, resources always tend to, the farther down the pipe you get, the more resources have gone away. And then I think about the health professional shortage area. And I just wonder, in your position as our congressman and working with veterans, that, maybe it's time Congress take a look at when resources are allocated, that there be some equivalent shortage area designations. For example, let me give you an example. When this pandemic broke out, we had absolutely no idea that we would have to deal with roughly 70,000 American citizens that lived below the border that at some point in the time came here for medical services. Now, we are a health professional shortage area, but even being designated as such means we only have essentially one primary care physician for every 4,500 patients. We only have one pulmonary care for the entire county. We only have one endocrinologist, infectious disease guy for the entire county. Now, if you were to take that and transform that into veteran services, how much veteran housing do we have available for homeless? So maybe when they're doing this grand scheme of things that we've got to do, and I taught history for 30 years, and I agree, Congress needs to step up. We need an equivalent New Deal kind of program. But when they do that, they consider about those shortage areas. Because if you look in South Dakota or North Dakota, they're in the same boat we are. And so, we're just representative here in the border. If you look at Yuma, they're a little bit better off than us. In San Diego County, if you were to take San Ysidro, Chula Vista, what are the three border towns? If you were to separate them from the rest of San Diego County, their infection rate was equivalent to ours. The reason San Diego County wasn't high was because they were all blended in together, but the border areas. So, maybe when you guys are writing this thing, you give a thought to, a designation for shortage areas, a special designation, a greater allocation of time, money, or personnel for those areas, so that Mr. Preeb can continue doing the good work he does, but we can get some help for our DSOs down here through a special financial supplement that the county can't foot the bill, and he's got so much stuff to do, he can only do so much. But if they had a special incentive for smaller areas like ours, it'd be the equivalent of the Medicare health professional shortage area. It helps us get folks down here.
And, one of the things that I work with, interestingly, in Washington, I work with the rural communities, and people wonder why. I represent the border in California, and I said, because we have a lot of the same issues the rural areas have, the shortages, and we're attempting to do. I got to tell you, I'll be frank too. There's a lot of poor areas in the country that are rural that suffer exactly the same situations that you're suffering in Imperial County right now.
Yep.
Imperial County is a little bit different. Now, I've been through the hospitals. I dressed up and went into your ICUs, and I saw people that were suffering. One of the things, and the reason you said it, and a lot of people don't say it, but the truth is, there's a lot of American citizens that live on the other side of the border. And when they got sick, a lot of them came across to get better service in California, and it's understandable. When I went through the wards there, and both in Brawley and in El Centro, I saw people that were originally, they're American citizens, but live originally in the valley, live somewhere else, but they needed the service. I'm not neither here nor there, but that's just reality. And again, that's a uniqueness that Imperial County has. One of the things that we have seen, Tom, that's interesting, you know, I'm a Latino, and I pay very much close attention Latino community and the issues. Disproportionately, we've been hit harder than any other group, it looks like, in the country. And the reason for that is a lot of us are what they call essential workers. A lot of Latinos are essential workers. So you have a lot of people then that have been susceptible to getting COVID-19 because they've had to continue to work. They haven't had the luxury to work from home virtually. They've had to actually go to work. And in doing so, they've gotten sick. Again, it's been a tragedy, but it's one of the things I keep bringing up. You know, let's take a look at those essential workers and help them. So many of them are immigrants, and so many of them are Latinos.
Yeah.
Congressman, I'd like to address to you a little bit about the resources, kind of back up just a little bit, and specifically funding. And Tom said, great, those programs offer those programs, but I would really like to encourage funding for nonprofits. We are a nonprofit, and one of the things that's very, very difficult for nonprofits like 0800 who are in a prevention model, it's so difficult for us to find funding for a prevention model. I like to say a lot of times prevention's not sexy. People don't want to really fund that. How do you prove that what you did is really effective? So when it's prevention and there's not necessarily an issue imminent, but you're finding the resources and you're trying to connect them to the resources that they need before it's a problem, it's really difficult to find funding for that and to find funding for mental health. We would love to have, I'd love to have too many mental health resources to refer to, but the funding just isn't there for it. And providing the money through the VA to hire more social workers or clinicians to be able to give that mental health care to the veterans as they transition out, or even throughout the whole spectrum, their whole life cycle, they should be able to have that access to it. It's really for the nonprofit side of it, funding is very, very difficult to get for most specifically your prevention models, to have access to the money to provide the service.
I agree. I mean, maybe and I know we're going to run out of time here, but maybe we should talk a little bit about then the Commander Hannon Veterans Mental Health Care Improvement Act of 2019, because it's one of the things it attempted to do, as you know, is to get money also for prevention and to get money into the hands of those that are working to prevent suicides and other issues associated with mental health. Again, I couldn't agree with you more. I mean, prevention's not sexy, but it's not only a lot cheaper, it's the right thing to do. I mean, it's the right thing to do, try to prevent people from having these issues that ultimately sometimes take their lives.
Yeah, and it's been, I'll say, one of the biggest difficulties for us over this COVID pandemic is obviously we know the TAP classes stopped. 0800 has an MOU with Navy Region Southwest to present our program at those TAP classes. And while there are still services available for them, like I mentioned, our enrollment completely has we used to enroll 20 to 30 people a week, and we've had maybe a handful that have enrolled in our program. So even having a hub for them to find those resources that would be available to them is difficult. But then knowing too that the resources are out there wanting to help, and how are we making those connections? The mental health of our veterans is top of mind, I think, for everyone right now. And mental health just in general is top of mind for everyone. But for our veterans, I think it's even more crucial that we give them the support that they need, because they did support us. I mean, they've supported us. They're the reason why we're here to be able to speak as freely as we are right now. So we should be there to give them whatever resource they need.
That's right, as you know, and we're trying to provide more money. But I totally agree. Yeah. I mean, we have to allocate a lot more money, and again, to nonprofits to do this work, and as well as the government too. I mean, both. We just need a lot more money. We provide, I think, not necessarily all the money we need, but we provide a lot of money for armament and other things around the world. But when people get out, we don't necessarily give them all the things they need to defend themselves against the world, and the things that they need to keep healthy, strong, and vibrant lives. Yeah. Now, I know that we're coming to an end here. I have to say this. I really appreciate what you do. I really do. I never wore a uniform. I wore a clerical collar. But oddly enough, I was in El Salvador during the war in the 80s. I was down there in a place called Chalatenango, and I got to see war up close. I didn't have a weapon. I had a Bible. But I did obviously communicate all the time with people on both sides of the war, and the things that human beings go through during a war, veterans, things that are really almost unspeakable, the horrors that they go through and live, the fears that they have. I understand a lot of them just because I was there, not as a combatant, but as a religious man. And so I don't think we do nearly enough to help them, especially people that were in combat. Just the human being is not made for that kind of stress. Our humanity just isn't. We need help when we come home. Anyway, I appreciate what you're doing. I appreciate all the work you do. I don't think we do nearly enough for veterans. We ask them to sign on the dotted line. They sign that blank check, and then when they come home, we kind of scattershot and help them. We don't guarantee that we're going to be there for them in the way that we should be. But I know that you try to do that, and you do that with limited resources. I know each and every one of you do that. You have fantastic reputations, and I hope you keep going, working hard. I hope God blesses you to keep that strength and that ability to do it up. Would you like to comment here before we end? I'll give you all the opportunity, and then we'll say goodbye for the moment.
Just speaking on behalf of the veterans in Imperial County, the younger ones as well as the older ones, the fact that you're willing to keep us in the picture at the forefront is of immeasurable value. You're correct. How do you take a young person that's been taught their whole life to be a wonderful person, love everybody, kill nobody, follow all the rules, yada, 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 send them off to war, say those rules don't apply anymore, they come back and the rules apply again. There's a huge moral conflict that occurs. And those folks in World War I, they called it the 1,000-yard stare. In World War II, they called it shell shock. In Vietnam, they called it nothing until the late 70s. Then they called it PTSD. And so mental health is a major issue. But so is economic health. I says, it doesn't matter how much you love your wife and you love your kids. If you don't have money, if you don't have a job, it's very difficult to maintain a marriage and maintain mental health. And so all those things, the veterans don't necessarily deserve to be first in line, but they darn sure need to be considered really up top.
Tom, I just want to give you a shout out for all the help that you do in Imperial County. And if you can help spread out that va.gov website to folks that might be in need. And Congressman Vargas, I just want to thank you for your support. I mean, fortunately, VA is such an apolitical organization, I feel, and it's practically every employee here is in it for serving veterans. And here at the San Diego VA Regional Office, 85% of our employees are veterans themselves. So obviously, we're always striving for continuous process improvement and doing it faster, but doing it correctly the first time. But then together, where we engage the community, our congressional stakeholders, at providing services and benefits that is expected of what this country expects us to deliver to veterans. So again, thank you for all your support.
Thank you.
I'll echo. Thank you all so much for the support. Thank you for allowing us to be part of this panel today, 0800. And Dr. Preeb, with all the work that you've been doing on those weekly county meetings, thank you for those and all those VA updates. I've gotten so much information to be able to share with our service members, and we try and tell every single one of our service members, if they do nothing else, apply for their VA benefits. It's critical. They have access to so much, but a lot of times they just don't want to do it. Thank you for all your work in Imperial County, Tom, and thank you, Congressman Vargas, for allowing us me to represent 0800 today.
Again, thank all of you. I really do appreciate it. And God bless you. God bless our veterans and God bless our country. And again, thank you for your service. It is so much respected and needed. We appreciate you all. Thank you. God
Thank
bless
you.
you.
Thank you.
Peace.